Okay, so in this video, we'll take a look at the pyogenic meningitis and tuberculous meningitis, which are the two important types of meningitis in children. So, in case of pyogenic meningitis, the classical triad of high-grade fever, headache, and neck stiffness will be seen, and these will be the symptoms in the child. And the important signs that we're going to be seeing is knuckle rigidity, Kernick sign, Brzezinski sign, and bulging anterior fontanelle. So these are the out of these, the knuckle rigidity, the Kernick sign, and Brzezinski sign are the signs of meningeal involvement or meningeal irritation, and the signs such as bulging anterior fontanelle, nausea, vomiting, and photophobia. These four are the signs of raised ICP, because we know that meningitis is also associated with sometimes raised ICP. So there will be signs of raised ICP and there will be signs of meningeal irritation. Okay, so what are the causes of pyogenic meningitis or bacterial meningitis? So in neonates, the most important cause is group B streptococci. In preschool children, it is the H influenza. In young adults, it is Neisseria meningitidis, and in older individuals, it is the pneumococci and meningococci. So what are the differential diagnoses in a child with bacterial meningitis? It is tuberculous meningitis, brain abscess, brain tumor, and cerebral malaria. Now, what are the signs of raised ICP? It is often asked. In case of raised ICP, there is a classical triad called as Cushing's triad, which is characterized with hypertension, bradycardia, and irregular breathing. And in addition to this triad, there will also be papilledema, cranial nerve palsies, hyperreflexia, hypertonia, and bulging anterior fontanelle. And there can also be increased tendon jerks and extensor plantar response. So these are the signs of raised ICP. Now, what will be the important investigations in a child of pyogenic meningitis? These will include CSF examination or CSF analysis, which will show turbid CSF with increased protein content, decreased glucose, and increased polymorphonuclear cells. And blood examination will do for CBC, which will show neutrophilia or leukocytosis. Okay, so next we'll also do the blood culture, which will be positive for any organism which is causing the meningitis, like it can be a bacterium or it can be a TB organism. So we'll do the gram staining and we'll do the Zn staining in the individual. We'll also do the coagulation profile, PT, APTT, and RFTs. So these are the important investigation in child of bacterial meningitis: CSF examination, blood culture, and RFTs and coagulation profiles. So what are the other investigations to check for to rule out other causes or to identify a particular cause? So we'll do the radiological examination including chest X-ray, MRI, CT scan head, LP or lumbar puncture after CT scan, serological testing to detect antibodies against a particular organism, PCR for viral DNA or RNA if we are suspecting any viral meningitis, and electroencephalography to rule out any other cause of disease. So these are the other investigations. So what will be the treatment of a pyogenic meningitis? Number one, it will be supportive management, including hospital admission and resuscitation, passing of IV line and monitoring of vitals, urine catheterization, passing of an NG tube, maintaining input-output charting, neurological assessment will be done frequently, and controlling body temperature, because these patients present with high-grade fever. And also we'll start with a short course of steroids like dexamethasone, anticonvulsant to control seizures, and mannitol or 3% saline is given to treat raised ICP. So these are the supportive management options. Now, what are the specific management options for pyogenic meningitis or bacterial meningitis? These include antibiotics like benzyl penicillin, like third generation and fourth generation cephalosporins. In third generation we have ceftriaxone and cefotaxime. In fourth generation we have cefepime. Okay, then other antibiotics include vancomycin, doxycycline, and the antiviral acyclovir. So these 5 drugs will be included in our empirical therapy for meningitis till the culture results come back. Now, what is the prevention plan for contacts? If a child is in a house and we want to protect the contacts, what will be the prevention plan? So it will include chemoprophylaxis and vaccination. So for chemoprophylaxis, we will give, in case of H influenza type B, we will give the household contacts rifampicin in the dose of 20 milligram per kg per day for 4 days. And if it is meningococcal meningitis, then we will give rifampicin for 2 days or ceftriaxone IM single dose or intramuscular single dose 125 milligram to children. So these are the important chemoprophylaxis for Haemophilus influenza type B and meningococcal meningitis. Now, vaccination will include in unvaccinated infants, vaccine should be given in 3 doses, and in a child of more than 12 months of age, a single vaccine dose will be enough. So 3 doses for an infant and 1 dose for a child more than 12 months of age. Okay, now this was the prevention plan. Now, what are the possible complications of meningitis or pyogenic meningitis? These include the neurological complications like cerebral abscess, obstructive hydrocephalus, subdural empyema, thrombophlebitis, Waterhouse-Friderichsen syndrome, epilepsy, and cranial nerve palsy. These are the neurological complications of pyogenic meningitis. Now, what is the treatment of cerebral edema due to raised ICP? The treatment includes hospital admission and resuscitation, passing of IV line and monitoring of vitals, maintaining input-output charting, elevation of head at 30 to 40 degree, and also steroid therapy, sedation, and mannitol or 3% hypertonic saline to treat the raised ICP. CSF drainage can also be done by making a shunt via a small hole in the spinal cord or skull, and also treat the underlying cause like meningitis. So these are 9 other treatment options for cerebral edema due to raised ICP. Admission, hospital admission and resuscitation, passing of IV line and monitoring of vitals, maintaining input-output charting, elevation of head at 30 to 40 degrees. Steroid therapy, sedation with benzodiazepine, mannitol or 3% hypertonic saline to treat raised ICP, CSF drainage by making a shunt, and treatment of the underlying cause. Now, what are the contraindications to doing a lumbar puncture? Number one, contraindication is the raised ICP. Especially where there are focal neurological deficits, then we don't do LP. Then if there is a severe cardiopulmonary compromise, then we also don't do LP. And in case of infection of the skin overlying the site of lumbar puncture, then we will not do it. And bleeding or clotting disorder. So these 4 are the contraindication to doing a lumbar puncture. Now, what are the important points regarding tuberculous meningitis? Number one, it will have an insidious onset, and it will be consisting of a triad of a low-grade fever, headache, and neck stiffness. The signs will be the same as those seen in pyogenic meningitis, and there will be other features of TB as well, like cough, like we can say evening rise in temperature, like night sweats, etc. And what are the possible investigations for tuberculous meningitis? These will include CSF examination, which will show Cobb-Webb CSF, not turbid, Cobb-Webb CSF, increased proteins, decreased glucose, decreased chloride, increased lymphocytes, not polymorphonuclear leukocyte that we saw in pyogenic meningitis. And the rest of the examination will be the same that we saw before. And also the investigations specific for TB will also be done, like chest X-ray, like antibodies, etc. So what is the treatment of tuberculous meningitis? Supportive therapy will be the same as pyogenic meningitis, and in addition to that, we will also give pyridoxine to prevent polyneuritis in children with inadequate diet. So if the child is suffering from tuberculous meningitis, we will give the supportive therapy as well as pyridoxine or vitamin B6 to prevent polyneuritis in children. So children with tuberculous meningitis are at increased risk for developing polyneuritis. And specific therapy for tuberculous meningitis will include 12 months of HRZE, which are the 4 drugs, or the ATT, which are the 4 drugs for TB. So 12 months of therapy will be required, not 6 months. And the complications of tuberculous meningitis are the same as those for pyogenic meningitis, but in addition to this, there will also be mental retardation, optic atrophy, hemiplegia or paraplegia, epilepsy, endocrine disturbances, and tuberculoma. So these were the important points that we have discussed regarding tuberculous meningitis as well as pyogenic meningitis. I hope it was helpful for you guys. Thank you so much for watching.